be against vaccine mandates, and it doesn't matter how many lives vaccine mandates will save, and it doesn't matter if everyone will die if there was no vaccine mandate, because they just have this normative preference. People have these rights and they don't want them violated, and it just doesn't matter how many people die. So that conversation will be interesting. I'm not saying that's what you hold, but that's it's much. If we disagree on anything descriptive, it probably would be a more fruitful discussion than just a shit show. Well, I disagree with this law or this rule, and it doesn't matter what the consequences are. It doesn't matter what the facts of the matter are surrounding it. It's just these are my normal questions. Like, that's not the kind of rabbit hole I'm looking to go down.
Makes sense.
I'm happy to. We talked about some stuff before. Like, I remember a long time ago, you had interviewed me. I remember you mentioning things like Brett Weinstein, ivermectin, stuff like that. I don't know.
When was that, sorry?
No, that was John Venus.
Oh, that was
his brother.
John Venus.
Yeah.
Oh, I'm sorry. I'm thinking about the wrong Venus.
Okay. Yeah.
I think the only time we talked was actually you helped me. You were very helpful. You and sorry, I forget his name. Isaac from
Yeah, Isaac.
Yeah. So we talked a little bit when I was thinking about debating Bart K at one point, and
I remember. Yeah, I remember that. Yeah. Okay. Cool. But I have no idea what your views.
Yeah, no. So that's the thing. I don't know if we disagree on anything. To be honest, I'm not necessarily against masks I'm definitely against mandates when it comes to vaccines. Not because I don't believe in vaccine efficacy. Just I think it goes against the principle of autonomy and
See, that's what I was talking about earlier. So, let's just say that, let's just say hypothetically that these mandates will just save like a large amount of lives, right? Would you still be against them?
I think, to be honest, I think for the most part, well, it depends. I could see, there might be a certain threshold, and I think, if it would be like no matter what mandate type thing, like a universal mandate, I'd probably be against it either way.
Well, in Leo's video, he was basically saying the amount of deaths that occurred from coronavirus so far are minuscule. So you might want to define what he would actually consider a lot of deaths.
Well, I wouldn't say, again, I don't know if that's an accurate representation of what I think. It's, it's very easy to misunderstand what people say. My main issue with well, not even an issue, but what I try to bring across in my message is that fear and panic is never good, right? So even if it is a very severe situation, being fearful and panicking over things is never good for one's own personal health. And when it comes to, it wouldn't be a minuscule, but it's definitely, in my opinion, far less severe in terms of its lethality rate, et cetera, than what it would seem to be from the media portrayal of it. But that's not a serious situation.
Let me ask you this. With the amount of deaths so far and the infection rate and the IFRs, do you think the mask and vaccine mandates are justified now?
No.
Okay. Maybe that, I don't know if you'd want to debate that.
Richard, what's justified is going to be indexed to whatever his threshold, right?
And also it depends what we're talking about. Is it, are we talking about mask and vaccine mandates for, certain particular areas? Like, for example, if you're working in healthcare and you're in touch, you're in contact with people at risk.
Sure. I think it would be the general population. There may be certain groups that may be excluded. There may be certain, there may not be completely universal, but generally speaking, I think.
Yeah, I think that's just it's just like a principle type thing for me. Freedom is one of my, I've taken the vaccines. I've taken many vaccines. I've worn lots of masks. Again, I'm not against these.
I get it. So this is just going to be the point. I'm just trying to make a time like investment decision here, because like what's not going to be interesting to me is me being able to point out, oh, actually, it turns out there's like a whole lot of deaths that are going to happen if we don't do this. And it's not minuscule. I'm not suggesting we panic. However, it turns out that the numbers are actually a lot larger than you think they are. And then you essentially just saying, well, even if you've shown this, okay, I just don't care. Because
have you heard that conservatives literally believe that?
And I'm against So that's why it's really annoying to get into these like normative debates surrounding a lot of issues, but yeah, vaccine and masks are one of them, about whether we should or should not do mandates. It's just really it's boring. Like, I mean, I could do it. I could just point out, like, hey, like, it's over, Theo's in this position, but it's just boring.
I agree. That's kind of, I was a bit surprised by this message, because I didn't really think there was much of a debate.
Well, no, there might be. I mean, there might be things to debate. The descriptive things are more interesting. Like, okay, well, but then we make progress. Like, if you think that only a certain amount of individuals died from COVID, and I think that number is a lot higher, then that's something that we might be able to resolve, actually, because it's not. You notice how that's not about your principles anymore. You can't actually use that to defend anything you're saying. You can't say, well, I appeal to freedom. Well, okay, well, that has nothing to do with this. Right? So there's just a fact of the matter of how many people are dying.
Of course, and that's I don't disagree with the facts. That's it's always good to look at. So again,
all right. So I think that if we disagree on anything, I'd like it to be ideally it was something descriptive about either COVID or the vaccines, or I don't know if you're buying into any early treatment or whatever. If that could be on the table too, like, or any of those things about like, well, here's the fact of the matter, and I think the fact of the matter is this way. I think this is true. You think it's false. Like, that's going to be the type of thing that can lead to a productive debate here.
Just as a quick screen, then I would say, I'm against the mandates for vaccines for sure.
Okay, but now you're going back to a normative question. That's like Leo.
Nigga.
You just said a normative proposition. Like, again, like when you say you're against the mandate for vaccines, like I grant that.
Okay, so a descriptive. Give me a couple examples.
Do you understand why I'm doing this, right? Like, the point is just that, like, I just don't find it interesting. I mean, I could do it. It's just not. I just find it uninteresting to do all of this work to show, like, oh, look at all the lives that this would save, and then you just saying, oh, well, freedom, right? It's just going to be fucking boring. It's not going to be. We're not going to make progress on it. Like, now maybe it'll be entertaining for the audience, but I mean, I'm kind of getting bored of those type of debates personally. I'm trying to get into more productive conversations with things that people actually are capable of having their mind changed on. If you just have this principle of freedom and that's it, no matter how many people die for it, then, well, there's not much changing your mind I can do.
And cause a literal zombie.
It doesn't matter how many bodies I can wind up for. You'll be against the general or universal mandates regardless.
Probably, yeah, probably. But again, I'm not like I don't really like necessarily even care or want to do a debate. You guys just contacted me, so if you have something you want to debate, go ahead, let me know. But again, this is I'm just.
Yeah, you might want to.
No, I should tell you, Leo. One thing I should tell you is I think that view, and you probably know this, but I think that view is absolutely nuts. It's crazy. It's like a horrifically evil view to me.
Which view?
The view that no matter how many people die, that would have been saved otherwise. Freedom regardless, freedom.
Well, I never said that, so
Well, that you would be against you just said that you would be against the universal vaccine mandate, but even if it could be shown that it would save all of these lives.
Well, yeah, that's two very different propositions than saying, no matter how many people die, that, well, I mean, there's never been a situation where, vaccines save everyone, and
that's not relevant. That's not relevant because I asked the question in terms of hypothetical. The point I'm trying to get at is here.
I'm talking about the real world. I would never.
Yeah, but that doesn't. But I'm not. But I'm not for a reason. Not for a very good reason. There's a good reason I'm not talking because these hypotheticals that are not real world are sometimes even more useful than real world scenarios. Okay, this is an example why. So,
well, why? I don't get.
Yeah, no, I'll explain it. I'll explain it because even if a hypothetical is just something that we ask if this were to be in the real world, if such a thing were to manifest, how would you respond? How would you behave? What do you think? That's the whole. It's a super important part of planning things out. It's an important part of evaluating situations. It's part of foresight. It's part of planning. It's part of our prefrontal cortex. That's the most. Actually, it's one of the major things we evolved with. It's the ability to engage in counterfactuals. And that's all a hypothetical is. It's to say, like, okay, if the real world were this way, okay, we grant that it's not this way, no shit. But if it were this way, what are your principles? Does it change anything? Does anything turn on it? And when I ask you, if the real world were this way, if the world were situated that there were all of these countless people saved by vaccine mandates, would you be against vaccine mandates? And you respond by saying, well, that's not in the real world. Vaccines have never saved all these people. That's just not answering the question. And the reason I'm asking the question is important because I'm asking the question because I'm trying to get to what your principles are.
Yeah. Well, I guess, Avi, I would say, again, to me, that's kind of boring, actually, to talk only about hypotheticals rather than the real world. I mean, there's a very, the thing about debates is,
This isn't answering the question either. I just acknowledge that it's not answering the question.
What is your question? If back in a hypothetical where 100% of people would die if we didn't vaccinate, would I want the mandate? Is that your question?
Unless we universally mandate it for everyone, would you be in favor of universal mandates, or would you insist on maintaining the freedom of everyone?
That's a funny question, but I mean, I think if you could prove that 100% of people will die, then yeah, let's mandate a vaccine.
Okay, so thank you for answering the question. Now that was important. The reason you could laugh, but that was actually the most productive part of this conversation, and the reason why. And have these little hypotheticals. Now I know that there actually is some threshold. There is some number. I don't know exactly where it is, but there is some number of people that could be saved, such that you would be in favor of a vaccine mandate if it were to say that many people.
Well, I mean, that's one way of thinking about it, Avi. The other way of thinking about it is this the only viable solution? I mean, I don't think there is a situation.
Of course, now that's just adding other things into the equation. Yes, I understand that there could be other ways. The hypothetical was such that if this were the necessary way, you got it.
So yeah,
in reality, they're saved on top of the vaccines and mandating vaccines.
Mm-hmm. Yeah, I mean, that's a fair argument, and I don't disagree. For me, and perhaps my threshold is higher than other people's threshold in terms of what point is it okay for us to remove people's freedom of autonomy, freedom to choose what they what kind of procedures, interventions, medications, etc. they want to consume.
So if you were going to go down that, I mean, I would probably just try to prod and ask you a whole bunch of hypotheticals that you wouldn't be interested in to just try to get closer range on where that threshold is and see if there actually is evidence such that, wherever your threshold is would justify management or not. And if it's just so high, I'd probably just call your threshold like you want crazy. So, I mean, this is why I find the normative proposition boring, because I mean, I'm just outlining what the whole debate would be. Like, there.
Yeah. No, I agree.
But I would just want. What I would want is just like more. I want to know if we disagree on any of the descriptive facts. Because look, if you have the super high thresholds, like I already just would consider. I would just consider like Now, I could do this in a debate, but I would just say, like, look, the degree of freedom that's lost by mandating a vaccine is just, to me, it's just such a, to me, it just doesn't compare in relation to the last thing. And I think setting a crazily high threshold for that is just seems nuts. But again, that's just me emoting. Like, that's just me saying what my values are.
Of course, and that's fair. You know, people are different. People think differently, and I respect your opinion.
Well,
but it's more interesting for us to talk about something where it doesn't depend on my feelings.
Well, I think you should watch. I think you should watch Leo's video because he does talk about how he thinks the COVID deaths are a little over exaggerated.
Okay, yeah, that's something that we should talk about.
Mm-hmm. Well, how you know. What do you mean by over-exaggerated? Like
Well, in your video, you were saying that you don't really trust the CDC recommendations for classifying COVID deaths, and you were essentially alluding to the idea that there's over-reporting.
Okay, yeah, I see what you're getting at. I would say I don't necessarily trust. Well, I don't trust 100% in any organization. Obviously, there's always a possibility for mistakes, no matter who you are. But I would say, yeah, the point I was trying to make was more of this kind of idea that it's not just purely COVID that is causing these deaths. A lot of these deaths are also caused by comorbidities, et cetera, right? So
that's just about every death. Yeah. So, like every death.
Oh yeah. That would actually be a really good topic to debate because Leo doesn't really seem to understand causal versus contributory.
Or causal contributory.
Yeah.
But no, that's the thing. I mean, I'll tell you my position. My position is that if you talk about if by COVID death you just mean if COVID either directly caused or causally contributed to the death, I mean, killed, in other words, in a counterfactual analysis, such that if the person didn't get COVID, they'd still be alive.
Actually, Leo literally stated that virtually everyone who's died from COVID would have died anyway. So COVID hasn't actually contributed to excess deaths. No, you literally said that.
That's definitely
look, I have to watch the video myself.
I said definitely some people would have died anyways.
The way you stated it, I think you might have forgotten, but the way you stated it, you said virtually everyone who has died from COVID so far would have died anyway. Like the way you worded it is mostly. And you're talking about elderly people who are already sick, already have comorbidities. So you were essentially arguing that there have not been any excess deaths due to COVID.
No, what I did say is that there hasn't been a big spike in overall global mortality. That's that's just what the numbers show. You know, we haven't had a huge decrease in the world population in the last 2 years. We've had actually the same exact growth that we've had prior to COVID. We have, like, some of these people, I don't know if I could have worded it better, but I definitely don't think that all of these people would have died anyways. But yeah, I think just to make it clear.
So I think we talked something that is good. I mean, there is data. We do have had lives of excess death above what was expected. I mean, that's just not true. We have. It
depends again on what your perspective is. Is it a global perspective? Is it a country perspective? Is it a age specific perspective?
Oh, you can dilute the excess deaths by including poor reporting schemas of countries that do a very poor job of reporting these things. Absolutely, I agree that you could. The more you include poor reporting, the more you can dilute those excess deaths down to the null. But if you have a methodology that looks at accurate reporting systems by any reasonable metric of what accurate reporting means, you clearly consistently see excess death. It's not even a question.
Yeah, Leo was arguing that COVID isn't responsible for excess deaths.
Unless, and by the way, the countries that accurately report that you don't see excess deaths, they ironically tend to be the countries that, when you do the best you can at adjusting for confounders, they tend to be the ones that actually lock down. For example, if you look at the Nordic countries, Sweden is the one with the greatest excess deaths compared to Denmark, compared to Finland, compared to Iceland, compared to all the other Nordic countries. Sweden is the greatest one, the ones that did all the freedoms. They had the highest excess deaths. And in fact, I think you could combine all the excess deaths. You can do all the excess deaths combined of all the other Nordic countries per capita, and they still don't get to Sweden.
Yeah, maybe I haven't looked at the numbers actually, so I'm on that exact point.
Yeah. Okay, but anyway, the point is these are the things that would make for good debates, because these are the things that were like, okay, well, it's not. There's no weasel options by saying like, oh, well, I just have this value and that's it. Like, freedom.
Well, I mean, whether or not it fits the debate format that you like is another question. But just the main.
Not a format. It's a topic. It's a debate proposition.
Yeah, for me, like the main place, I guess, that we might see differently on or whatever is most medical interventions, most things where somebody is at risk of because that's what we're talking about with COVID, right? Some people are at risk, some people are not at risk. I mean, to say that the risk of for example, me or you or Richard dying of COVID is almost non-existent, right?
Well, dying, as you said, the point of almost at mortalities, and yes, dying is almost non-existent, although there are a whole bunch of other things that are existent. Even within, but that applies to vaccination as well. Our chance of dying from vaccines are also virtually non-existent. The concern of getting COVID.
But the problem, if you just let me finish the point I'm trying to make is that when we're talking about at-risk groups, this is the first time in general society where I've seen the responsibility go from, where we protect the at-risk by making some intervention or something where we take care of the at-risk. The responsibility though is the at-risk, right? Whereas now, for the first time, we're going over to saying, okay, actually, in order to protect the people who are at risk, actually, that's going to be the responsibility of everyone, regardless of whether or not you're at risk. And to that step, to go from telling people how they should live and how they should behave and what medications they have to take, etc., based on protecting other people, that's a big step to take that would require, in my opinion, a very, very, very severe situation. Which
so this is again going back to the normative question. So this is why we're going back into boring land, but I can address it. So first off, like just to take you a step back into the descriptive land. When you say at risk, if you mean the outcome of mortality, you got to be specific about the outcome you're talking about. If you're talking about the outcome of mortality, sure. But there are other outcomes that young people might care about and should, usually do care about, that they are at risk, at a high risk actually, because they get COVID, based on the available, such as potentially permanent erectile dysfunction for young men, for example.
Yeah. How big is that risk? Do you know?
It increases from around. I believe it's around like 15 absolute percentage points of an increase, or somewhere around there.
Yeah. So you mean relative risk?
No, absolute.
15 points.
Yeah, 15%, around somewhere around there. It might be 12. It might be.
That's remarkably high for something so serious.
If you're going absolute risk of 15%, that would mean almost
the baseline rate.
20 out of every 100 young men.
Out of 100. Wait, why is that impossible?
Well, I wouldn't. I would need to see that data. I don't.
What's the contradiction? When you say it's impossible, what's the contradiction?
Well, I think I would have probably heard more about this if 20 out of every 100 men, unless people don't report their erectile
That's the whole
dysfunction.
thing. No, people don't report it. Men are actually very hesitant to report it. But actually, if you look at the erectile dysfunction medication trends, they've skyrocketed. If you look at the the proxies, even to control for that, people have not been having more sex, by the way. And then also, if you look at the limited as it may be, there's at least 4 epidemiologic studies looking at people who have had and have not had COVID. And the difference, even after controlling for comorbidities, controlling for even psychiatric comorbidities, you do see that, like that much of a difference in risk. And
well, I would like to see those papers. Again, I find it hard to believe that almost 20% of men have erectile dysfunction.
No, well, they don't have it. They may not have it right now. The baseline, by the way, the baseline in the United States is around like 10%.
Yeah. Well, I mean, erectile dysfunction is a very also multifactorial thing, right? There's a lot of psychological.
Well, that's why I mentioned all those things that are adjusted, right? Like, I'm not.
Yeah.
Well,
Well, I mean,
also, by the way,
for sure.
Just let me there's also mechanistic support as well. They've actually found that coronaviruses actually go to the corpus cavernosa of the penis, even for mild and severe COVID. The penis has tested positive 8 months after the initial infection. So they tested negative.
This is positive. What do you mean?
There are people who had, they had erectile dysfunction, and they had to get surgery for it. And they looked at the corpus cavernosa tissue, and it was loaded with SARS-CoV-2, the actual virions.
Oh, wow.
And it tested positive on PCR, and they looked at it on electron microscopy, and they saw all the virions there. Long after the person cleared the infection.
That's definitely interesting. That would be something I would like to read.
Yeah, I can send you the There's a lot of underreported. There's a lot of risks to young people, young men specifically, of getting COVID. That I'm not sure it's just understudied, but there is enough data to warrant a precautionary principle. And there's just not a lot of focus on it because people downplay it. They say, even though erectile dysfunction is linked with increased risk of suicidal ideation and depression and everything like that can kill you. They're like, that doesn't compare to myocarditis, even though vaccine myocarditis is incredibly less severe than MISC. So that's associated with SARS-CoV-2.
Yeah. Well, I mean, this was interesting for me is looking at the numbers, right?
The numbers are very high. It's a high absolute risk increase. Look, the data is limited, but it's enough. There's enough there to warrant the precautionary.
Well, I would I will be interested in seeing that because I still have a hard. If you're saying 10% of the baseline in the U.S. and say, okay, I mean 15% increase, that'll be 25% of people who have COVID.
It may be 10 and maybe 15. I have to go back to the study, but it was something very considerable. It wasn't something one of those studies that give you a 15% relative risk increase and your baseline prevalence is 0.001% or something like that. It's not even close to being that. It's something substantial.
Okay, well, I was not aware of that, so that's an interesting thing to read into.
Well, I think the big disagreement here is going to be with the excess deaths and the severity overall of the outbreak, both in terms of actual mortality and morbidity, so injuries from COVID. So I think you two should maybe work that out.
Yeah.
Well, just remind me, both of you are much better speakers than me. And you've already alluded to this issue multiple times. Can you explain to me exactly normative and descriptive? What exactly is it?
Sure. Okay. So, normative propositions about what you think we should do or what we ought to do. So, if I say, I get you. I should get some food. The refrigerator. A descriptive proposition is about whether a food, like example, would be like, okay, there is food in the refrigerator, but there is not food in the refrigerator. That's just, it doesn't matter what your morals are. Like, it's either true or it's false, regardless of what the values are. But that's not the same thing with the normative proposition. Like, you might just have a value against eating. You might have to say, well, no, actually, this is a holiday for me, and on this holiday.
Well, but that's the thing. I mean, that's why I don't think there is much for us to debate, because I'm always trying to make my decisions based on the numbers. But if the numbers show something, we're both evidence-based thinkers, and I think perhaps you have a better idea of what, since you are a clinical researcher, you work in this field, and maybe you're also just in general spending more time reading papers. But in terms of the morals and what I decide to do with my life and what I think we should do, that's I think the only place where we would disagree, because the numbers are the numbers. I don't think I'm going to disagree with that.
Okay, regardless of what your opinion is on what we should do with the pandemic, just some of the information that you shared in your recent COVID video, it was concerning, and it was certainly misinformation. So I think
let me know what was misinformation of those.
Oh, well, the stuff about excess deaths, that the pandemic isn't causing as much harm as you think it is, that was clearly misinformation, especially the specific point about excess deaths. That was just dead wrong.
Well, again, why do you think that there is no excess, or there is a huge excess mortality during the COVID years?
Because there is. Well, it's like saying, how do you think global warming is a thing? Well, it's because the Earth is fucking warming. That's...
Well, and it also depends what do you mean by a huge increase. For me, if we're talking about, again... Well,
that's a different normative claim. You could maybe think a massive increase in deaths has to be in the order of billions versus millions. But the specific claim you made is that there aren't any excess deaths. So there's a difference there.
There aren't any excess. The global mortality has not significantly changed. That's what the numbers show.
Well, you specifically stated in your video.
I'm not sure why I don't know how you would find that. How?
Well, Leo, the specific claim you made in your video was that the people who have died of COVID would have died anyway, whether COVID was present or not, and there was not. Yeah, well, the video. Okay, well, the video's up, and we can just see it for ourselves. But the statement you made was that the people who have died of COVID so far would have died anyway, on the aggregate, the majority. Maybe not every single case, but you at least suggested the majority, and you argued that there has not been excess deaths post-pandemic. So that's completely separate from some sort of normative statement that 5 million deaths is not significant. So what you consider significant or not is, yeah.
The two things I would say there is, number one, I do not think that most people, what I said in the video, if I remember correctly, and again, we can double check if this is a big deal, but I think what I remember saying is that the reason that this number might seem more scary than perhaps it should, and again, that's a normative statement, is because, yes, a lot or most of the deaths have occurred in people who are at risk, of course, and some of them definitely would have died anyways. And the global deaths in general have not significantly gone up during the pandemic.
They've gone up. They have significantly gone up. That's not true. We can disagree. That's fine. That could be something we could debate.
Yeah, I think that I think that topic. So I think that topic alone would be good to debate. Since you're still disagreeing, it's pretty clear to me though that after talking with Avi and I, you're walking back your statements because what you said in the video was very different than what you're saying now.
No, I think you're probably misrepresenting what I said, Richard.
Okay, well, Leo, you're a very handsome man, and you're looking especially handsome lately, I must say. And I'm not meaning to misrepresent what you're saying, but that's what I'm getting from like your video and what I'm hearing right now.
Yeah, and that's I appreciate you're a very handsome man yourself.
Thank you.
And the video, we can just correct that right now. That's not what I meant. I'll double check. I'll watch the video and see if that's what I said, but I highly doubt it. There's no way to say that all deaths would have happened anyway. That's ridiculous.
Okay, well, I think I'm just going to go back to my live stream because I'm live streaming right now, but you guys can kind of work out what you might be interested in debating. Just what I saw from your video was concerning. That's why I just hooked you up with Avi to see if we could work out some sort of debate. Or maybe
Excess death. The population that globally excess deaths have not increased.
Yeah, okay, cool.
Wait,
and
are we on a live stream right now?
Yeah, like I'm just talking into the phone.
Oh, okay, so like my voice and Avi's voice isn't on the
Oh no, you can hear it. I'm on speaker, but
well, again, I don't have anything against that. Would have been nice to know that before you started streaming them.
Yeah, sure, sure, but and if there's anything else that you might want to learn about the pandemic, I'm sure Avi can help you out with that, like with the erectile dysfunction stuff. I'm sure you'd be interested in learning. But yeah, that specific point about excess deaths is definitely worth debating.
Yeah, I would be interested in seeing what the numbers or what the data you use for, and what you mean by significant. What I've seen at least is. Global population has been increasing at the exact same rate as pre-pandemic time. So
yeah, and I'd be more than happy to host the debate on my channel too, if any of you care to do that. I know Leo, you didn't really like me, but
I can qualify real quick right now. I'm talking globally. I'm talking anywhere between we can go to the economist calculations, but it would be anywhere between 7 million and 13 million excess deaths worldwide during the pandemic.
Yeah, well, I'll be interested in seeing what data you're using, and also, again, mine is like the simplest numbers you could use. Actually, I'm just looking at exactly how much has the world population gone up by every year, and we're at exactly 82, just under 82 million per year, which is the exact rate.
But did you look at which countries are updating those numbers and which countries are looking at birth rates? Because looking at the population number, it's like that doesn't tell you excess deaths. Like that could just be compensated by increased birth.
Yeah, perhaps we've had 13 million more births last year. Who knows? To that point, people have been together more often. Maybe I don't think that, but maybe I don't know. But the point is that that's not the point. The point is that it's a more direct measurement to look at excess deaths or to try to calculate that directly than just infer it from populations, especially because censuses are taken. Some countries don't take censuses that often. Some countries take. It's just an analysis of looking at what you're trying to answer is going to be a lot better than inferring it from a different variable. Well, since we're on the live stream, then I might as well just say that to make it very clear. My stance is that the role of doctors, the role of public health agencies, the role of organizations aren't to tell people how to live or how to what decisions they must make, but instead inform and allow people to make informed decisions. And but in the end of the day, people have to be allowed to take if they are aware of the risks, they have to be allowed to take whichever risk.
Right, sure, but like that's a normative claim. So I don't know if you're still going to be interested in debating.
Notice the retreat to the normativity as soon as we drill down into the descriptive.
Yeah, so I don't know if you're still interested.
And also notice how I never asked to be drilled on anything. I thought this was just a friendly conversation, and then I realized later that we're on a live stream.
It is. By the way, Leo, it is a friendly conversation for me. I didn't know we were on live streaming.
Yeah, well, I'm not retreating from anything. I just.
Right, sure.
See.
Right, it like we don't really care about the normative claim. Like we just want the Avi's only interested in debating the descriptive. I'd be fine with debating you on the normative claim. That'd be fine if you're interested. I know you don't like debating me because I'm kind of an asshole, but.
No, I have nothing against debating anyone, Richard. That's fine.
Okay, sure. Yeah, but if you're still interested in debating the descriptive claim of excess deaths, Avi would be happy to do it, and I'd be happy to debate you on the normative claim if you want. But I'm just gonna head back to the live stream. If you guys want to talk more, go ahead. So take care.
Bye-bye.
There we go.